You guys remember that time I never started the recording? We got like 10 minutes into the show. That was fun. This podcast is for informational purposes only. It is not intended to provide medical advice. It exists to entertain and to inform. Yeah, so I was stoked because I met a fan at work the other day.
Oh, cool. What'd they say?
They said they loved the show, and they said they loved the show because the voices and sentient computers were gone.
Ouch.
Yeah, it did hurt.
Oh, yeah. Hey, is that door new?
What door?
Well, that door over here at the back of the studio, it looks really heavy. No, it's one of those big, like a wheelie lock things.
Like a bank vault.
Where's Mike?
Surprise!
Where did you come from?
I was sleeping under the desk.
Why?
Because I had to pull an all-nighter to finish installing a vault door.
Why is there a vault door?
Well, we've been at this for several years now.
Mm-hmm.
So I figured we should start our own annals of medical history.
Wait, what?
Yeah, this whole time we've just been doing the podcasting, throwing away the episodes. Now we can store them in the vault. I call it the Poor Historian's Annals of Medical History. And there are so many shelves inside.
Mike, we record the shows and we upload them onto servers. They're not physical objects. You don't put them on shelves.
Mike, do you know what a podcast is?
I know that I'm on a podcast.
Okay. What? You know what? We should just start the show.
Hey, Mike.
Yeah?
Did you do the sign above the vault door?
Yeah, do you like it?
Annals has 2 N's in it, man.
Wait, it does? Didn't look right.
You know, Mike, I like it. I like the effort. Maybe we can find a use for it. You know what? Let's collect medical artifacts and we'll keep them in the vault.
Yeah, that's a good idea. And maybe the items have to do with the show topic?
Oh, excellent. Aaron, what is the show topic today? Let's find something, an artifact that we can examine.
History of breast implants?
It's a bad time to pitch that idea.
I totally disagree.
I want to see where it goes.
Oh, geez. Recording time?
Recording time. Welcome, everyone. This is Poor Historians, a podcast misadventuring into the archives of medical history and beyond. I'm Dr. Max, and I'm joined here by my good friends and colleagues, Dr. Aaron.
Oh, I forgot how I was going to enter. Man, hi there. Wait,
and Dr. Mike.
Hello.
As well as our medical history intern, the second most Italian person on this show, behind Dr. Provolone, of course, Alba.
Buongiorno.
Ooh, problematic. I would dial it back a little bit, will you? We don't do the accents anymore.
I can.
Yeah. Dr. Provolone finds out that you're talking like that, he's going to be very disappointed in you.
Oh my, I'm so sorry, Dr. Provolone.
Yeah, he'd be very upset. He's on a sabbatical right now.
Mm.
So unfortunately, he's not reachable by telephone.
Well,
I do like
or
to
email.
imagine the new listener has no idea what that reference is. And then there's the other listeners who get it and enjoy it.
Oh, I'm sad we're not doing accents anymore.
Mm-hmm.
It's okay.
We need to do a T-shirt that says the stitches are too tight.
Ooh,
And the back
great.
just
That's
says
a-
Dr.
Stitches
Provolone.
are too tight.
It's not
that's
a
gonna be great.
terrible idea.
I
Well,
like this. It's
It-
funny.
Speaking of fans who would get every reference and call back to our previous shows, let's talk about and thank one of our patrons. And so we have a new patron member to the show. We have Nick, who has joined at the medical history resident level over there on our patron page. He's joining the medical history medical history house of medicine.
Medical History?
I
The
know.
House of Medicine?
I came up with it and
There
I don't
was a
remember what
house.
it is. Nick is part of the medical
Uh.
history house of medicine. And so what we wanted to do, Nick, we wanted to say thank you in a special and unique way. And that is we were going to ask Alba to use her improv powers to give you a thank you in the form of a after sports victory speech, like the sideline reporter of whatever sport she's thinking of.
Absolutely. I just want to say thank you so much. You know, Team USA was able to get the gold in Olympic vaulting, field and track, And I just want to say that's thanks to you, Nick. You know, knowing that we had your support, we took those vaults and we jumped over those other vaults and we did it. Thanks, Nick.
You're not thinking of the pole vaulter, are you?
Yeah.
Oh, yeah.
Oh no.
With the bump.
I wasn't thinking of that, but yeah, now I remember that happened.
It's okay. We're all thinking of that forever.
Oh my gosh. Oh boy. That's is that an embarrassing moment or is that like
dude's
moment?
Dude's a legend now, even if he didn't get a
I
medal.
wasn't sure how one might feel about that.
Just think about how much you'll make on OnlyFans now.
That's true.
I think he probably does have
The
a
best way to
sponsorship coming.
lose the Olympics.
You know what, listener, if you have no idea what we're talking about, don't worry about it. But if you do appreciate our humble show and want to count yourself among the super fans, we invite you to check out our Patreon page at patreon.com/Poor Historians Podcast or via the link in the show notes. Get access to our episodes early, an occasional bonus episode, and converse with us and other members of the PH Pod community over there on the Patreon page. All proceeds go to production of the show, and maybe someday we'll hopefully be able to hire some folks. So enough of that. How about we give some non-medical opinions? It's a little time we like to take in the early part of the show to warm up our faltering brains and help out a listener in need. So in the non-medical opinions segment, since we don't give medical advice out on the show, we figured we'd do the next best thing and use our medical and medical adjacent knowledge to give a lucky listener the best pearls of wisdom on a topic that doesn't have anything to do with medicine. So on this episode, we have a question asker named Earl. And Earl's got a question. I think you have it there in front of you, Alba.
I do. Earl asks, my problem is I have dog hair from my dogs over the past 20 years. And I was wondering if you and your 3 friends have ideas of what to do with it. I've tried to make a toupee for myself, but I couldn't get it to work. Any ideas what to do with the hair would be greatly appreciated. Love your show.
Man, I said it before, but I like how odd our fans are and how they're kind of getting weirder.
So, yeah.
I'm saying we are encouraging that. So, okay, but we need to help out. We have 20 years worth of dog hair. We need to have a disposition for it. Mike's a disposition artist. Mike, what do you do with that?
So, I would recommend using it as a filler when you make a Jell-O mold.
Oh,
so Jell-O can be really expensive, and the dog hair is free because you've already collected it, and it will just increase the volume of the Jell-O. You can only bring this Jell-O over to events that you never wanted to go to to ensure that you'll never be invited back again, or at least not asked to bring a side to pass.
I feel like I've seen a lot of reels on Instagram lately of like these old 60s commercials for Jell-O molds that had a lot of mayonnaise in them.
Mayonnaise?
There's like mayonnaise. And
Yeah.
It's very disturbing.
Oh, yeah. It's like cloudy Jell-O.
I don't do Jell-O.
I love mayonnaise, but it doesn't go in Jell-O.
No.
Or when people put fruit in Jell-O, that's gross. But dog hair is perfectly fine.
Okay. I think that's reasonable. Aaron, what do you got?
I mean, you're going to need a friend for this one. But what I would do is you just get a bunch of very important medical grade skin glue, and then you put it all over your back. And then while it's still wet, you have your friend or companion just sprinkle that dog hair all over liberally. So you have a nice covering, nice even covering. And what this will do is when you're in a cold climate, you will be shocked how much fewer articles of clothing you need to go outside. I mean, you're going to be like just set. You're going to be well insulated, and it won't like come off in the rain. So it's very, very, helpful when you're going into an outdoor survival situation.
It's practical.
Just in case. You never know. You never know.
Okay, fair. That's a practical solution.
Yeah, I mean, if it's dog hair, you might even get some free, like, just pats on the back and pats on the front.
He's a good boy. He's a good boy.
He's a good boy.
I think this show's turning into something else. Alba, what do you have that's less weird than that?
I mean, my thinking is you should count them. Because if you've been saving these dog hairs over the last 20 years, you need to know how many individual dog hairs there are. And I would bet that you would benefit from the meditative practice of counting every single individual dog hair.
Okay, interesting. Okay, here's what I'm going to say. I'm trying to imagine 20 years worth of dog hair. That's a lot of dog hair. So I feel like you can fill a fairly good size vessel with that. And what I would do is I get one of those like pretty generous Costco sized kiddie pools and put the dog hair in there, just like fill it up, and then sit in your front yard, wade into your dog hair pool, and just exist in front of your neighbors. And this works best if you have an HOA, because there's absolutely no chance that they have that in their bylines that you can't do that.
Like,
And it can
where's
become
the
this
law?
huge, messy fight because you're like, dude, the neighbor is just sitting in a bunch of dog hair in the front yard. And we're like, yeah, we didn't write that in the bylines. So I would stand on that principle, and I'm kind of a weird guy, but I think that's a reasonable use of 20 years worth of dog hair.
I don't know if it's that much hair. Just trying
20
to think.
years. I emptied my vacuum like 4 times in one level,
Yeah.
like one vacuum.
Depends on what
look
kind
at
of
me,
dog
I
they
have a
have.
vacuum. Oh,
Mike,
king of the
stop.
castle, king of the castle.
Mike, stop.
Get fat shame.
We don't come on the show to brag about how much wealth we have, Max. You and your vacuums.
I don't want to know what you
Mike,
use.
do you need a vacuum? Are you okay?
I have broom.
Maybe you should make a broom out of it, Earl.
Okay,
Earl,
all right. As
would
long
you do
as
me
you
a
have
favor?
something to clean with, that's fine.
Earl, please send us a picture of 20 years worth of dog hair, and then we can put this argument to rest. I think it's a lot of dog hair.
I don't
I
think
think
it's a lot.
so.
Okay, well,
I think it's
guess-
a moderate amount of dog hair.
Oh, you know what we could do with it? Here's what we do, Earl. We should do a drawing for it, and we can give it away to the fan who wins.
Ooh.
We'll have a drawing for like a really good prize, and then
Zero
there'll be a
entries.
secondary winner who gets the dog hair. I think that's the best disposition for it. All right. Well, hey, if Earl, I hope you did find that helpful, and really appreciate you listening to the show and the kind words about the show. We do appreciate that as well. You don't have to send those with your questions, but if you want to, we're going to read them. If you're out there, though, and you're just sitting with an excellent question for us to use for this segment, go ahead and send it in. We are getting low on our supply. You can just go to that link at the bottom of the show notes or go over to our website, www.poorhistorianspod.com. Use the form there and send us a, I guess, escalatingly weird series of questions that we can try to answer. I like where you're all going with that, just for what it's worth. All right, Aaron, are you ready to start your topic again after the recording button was actually pressed on my end?
I am ready. I can't use the same puns, though, at least not in the same order.
Nope.
I should have, maybe we put this somewhere else, or just make sure in the liner notes. So there is a good book here by Nora Jacobson, who I referenced. The first reference there is. All right. So we're going to talk about the history of breast implants and breast augmentation. And somebody told me a story the other day, and I forgot who it was because I'm that kind of person.
Because you don't pay attention, and you don't care about people.
No, I don't. I'm just
Wow.
exactly, yeah, pretty
Sick
much,
burn.
yeah.
Eyes up here, Aaron. Eyes up here. That's probably why you didn't remember.
Yeah, exactly. I was like, I'm distracted by tuning in Tokyo. I don't know. So then, they're like this apocryphal story about a 60s sort of Don Draper style doctor who was invented breast implants because they were standing in the operating room, probably with a cigarette, and they squeezed a bag of saline fluid that the patient was receiving and said, hey, that kind of feels like a boob, and then went on to invent breast implants. I was like, that's a good story.
I'm picturing these surgeons were what, Beavis and Butthead? Just like giggling and squeezing
like
bags of saline.
Wait, it feels like a bag of sand?
Babe.
That was all doctors in the 60s, Max. All of them.
Fair. Good thing we all matured.
But why weren't they squeezing boobs and say that these feel like saline bags?
They probably were if they were in an
Frowned
operating
upon.
room. Yeah, a little bit. Yeah, but then I did a brief search, and it turns out that the first sort of recognized breast augmentation surgery was in the late 1800s.
Can you define like what that is? I'm sure most of our listeners know, but just to be, let's get this on the level.
Well, I'm not a plastic surgeon, so
Not we don't need a step by step, but just like
there's
generally.
different varieties of breast
Way too technical.
augmentation. Yeah. Breast
Change
augmentation
breasts.
would be a surgery to probably increase breast size or fullness would be my guess. There's breast reconstruction, which would be to try to save or form a semblance of a natural appearing breast tissue after a mastectomy or something like that. And then there's also breast reduction, which would be just reducing the general size of breasts. And then there's mastectomy, which is actual removal of the breast tissue altogether.
Excellent.
So
like that
yeah,
summary.
there's hopefully that's okay. Plastic surgeons can at me all they want,
Please
because
do.
I'm sure they know better about a lot of these things. But Anyway, I was kind of hooked after 60s doctor plus mid-Victorian surgery. But, I said but twice. It's the wrong end. So we go all the way back. The sort of first recognized breast surgery was recorded or written down in about 650 CE, Common Era is anyway. So
It's a long time ago.
Is that AD then?
yeah,
Mm-hmm.
yeah. Paul of Aegina, which
I think it's Agina.
you can say it that way if you want to.
would.
I was just saying we should all go by first names plus where we're from. I think that would be.
Ooh.
Ooh.
Yeah.
I mean, I'm like Max from Milwaukee. I've got a nice alliteration.
No, I think you say of, not
Of
from.
Milwaukee.
Max of Milwaukee? I mean,
Of.
I'm willing to do that.
Yeah. So those were the initial descriptions were mostly gynecomastia surgery for cosmesis. So gynecomastia is a condition that results from a bunch of different underlying medical conditions. Usually it's considered pathologic in men who actually develop often a unilateral breast. So
It's like
they would
breast enlargement in a male.
Yeah.
Mm.
Yeah. So that was described at that time. There was sort of a second heyday in the 1600s, primarily talking about reduction, the sort of first recognized reduction mammoplasty. So reduction, just reducing, a mammoplasty. Plasty is just operating on or modifying the shape of. So breast reduction, there was a Dr. Will Durston, renowned doctor of physics in 1660s, who had a patient called Elizabeth Trevors who had such a bad case of gigantomastia or gigantic breasts that she literally ended up.
I think the
and
listeners
died.
figured that one out. Just
Yeah,
throwing it out there.
Gigantomastia, it's pretty clear there.
Yeah, she died of this. He said he helped her.
Wait, I'm sorry. Died of the surgery or died of the condition?
She was bedbound from the gigantomastia.
Oh my God.
Yeah.
Whoa.
So this is sort of the first recorded.
That was a really large breast.
Yeah. So he says he did a reduction mammoplasty in some of the books of the day, but people wonder about that because he didn't seem to really help her that much. He did an autopsy though, which didn't help her at all.
No, I think at that point you probably waited too long.
Yeah. Single breast weighed 64 pounds.
Oh my God.
By report, who knows, man, this is the 1600s. I mean, you can get some of these documents on JSTOR and I don't even know, but that's kind of some of the ancient history. And remember, these are still, the surgeries were without anesthesia. So this was back when a good surgeon is a quick surgeon.
Oh my God.
Just before our story really gets going, friend of the pod, William Halstead.
Ooh, big fan.
Yeah. So he raised sort of the issue of reconstructive surgery or breast reconstruction because he was an advocate of radical mastectomy as a treatment for breast cancer. So late 1800s, they had just sort of figured out that cells were a thing, and the cell theory led him to postulate that breast cancer was a local disease that then spread through the lymph system.
That's pretty smart for the time.
Yeah, I mean, still a similar model to what we think of today. So what he did is he just advocated cutting away as much as possible. So he, again, fast, unanesthetized procedure where he basically called a radical mastectomy, where he would just take all the breast tissue, the muscles underneath the breast tissue, all the lymph nodes in that region, and the skin over it.
Not to be that guy, but they did have anesthesia at that time, though, didn't they? Or was this before?
I'd have to go back to the Halstead. I'm not sure.
Wasn't Halstead the cocaine guy?
Yeah, the cocaine guy. Yeah.
Might have been early. Yeah, that might have been early. So maybe not pre-anesthetic.
It sounds more terrifying without anesthesia.
Yeah, it's still terrifying with.
Oh. Halstead, for any listener who didn't hear that episode, was the guy who did a bunch of cocaine and founded the idea behind a residency system. And, like staying up and working for 1 billion hours.
Now they don't have to listen to that episode.
That's right.
Yeah, that's about it.
Man.
Ruined it. Yeah, so Halstead and his disciples would say if it recurred, they hadn't taken enough, and they sort of actively discouraged any sort of breast reconstruction because they thought first off, the surgery they thought could maybe spread the cancer, so less surgery is better, I guess. And then because they thought the reconstruction could hide recurrence. The Europeans actually were the ones who sort of worked on early reconstruction because they didn't quite think of it the same way.
So the reconstruction being like they actually back then would try to restore this shape and figure of the breast.
Yeah.
It's actually pretty forward thinking. I know it seems kind of duh, but to actually put the patient back through a surgery at that time to restore like cosmetic and probably there's, not just cosmetic. What am I trying to say? Not just cosmetic, but like the personhood that is not personhood.
Yeah, it
Help
seems
me, Alba.
not. It seems uncharacteristic of the time. Like it's awfully concerned with the individual's mental health,
the patient's
and well-being.
self-image. Yeah, the self-image.
With the patient's self-image and
like
overall well-being for that time.
Yeah, that's good. I mean, the doctors throughout this whole story absolutely always put the patient first and totally didn't make questionable judgments about their personhood based on.
All right,
yeah,
excellent.
anyway,
You see what I'm saying?
Yeah.
It's like,
but yes.
But on this one, you're like, okay, we could help you out with that. But like every other thing, no. Like that's kind
no,
of
there were. I mean, this was definitely something that was discussed, and this was a big part of why they tried some of these early reconstructions. So, there's a couple things here sort of happening all sort of in parallel. So we're going to jump around slightly in the late 1800s and talk about a few things. But yeah, I mean, so H. Morstein is one of the early European doctors who was trying to figure out how do you reconstruct breast tissue after mastectomy? So he had one early option was to just take the breast from one side and stretch it to the other side.
Wait,
that was seriously. And they would create what was called a breast mound. So he would take a breast from one side, stretch it to the other, and the mound was.
How did they think that was a reasonable solution?
So they just had one boob across the.
Yeah. Well, I mean, I guess you would still.
Oh,
nipple. Yeah, no, forget about that. The nipple was gone, man. I mean,
really.
Or you could do a cyclops nipple, is what I would think.
You probably would end up with a cyclops nipple.
The opposite of the Total Recall chick with the 3 boobs.
Yeah.
There's some patient accounts at the time are not entirely pleased with the outcome. Is what they're consensus
You don't say.
I mean, come on! You wake up from that surgery and you're like, really? Like this? This is the great minds of medicine of the time. This is what we came up with. Come on.
I wonder if that was just a flap. It was like freely mobile tissue already, so they just use it as a flap.
Well, I think I think you're not wrong. That's what it had to. It's a solution. It may not be the best solution.
I mean, that would have been trying to deal with tissue loss from a radical mastectomy. Around that same time, 1882, Theodore Thomas, actually Gaillard Thomas, let's not leave out his middle name. So he pioneered incision under the breast so it would be hidden after healing. And that sort of increased this incidence of breast reduction and mass removal. So a lot of that became more common because it was less sort of obvious that it happened.
So basically the incision is hidden.
Yep.
Okay.
What's interesting to me is that the idea of reconstructing the breast through uniboob occurred to someone before the idea of putting the incision in a less visible spot. That is wild.
Well, that doctor probably had never seen a naked lady before.
Ooh, good point. Good point.
It was pre-internet. I
Like
don't know
one
what
of
it's supposed
those
to
is
look
way
like.
easier. One of those is way easier to do, and it seems like would occur to you much more quickly. But who am I to say?
That's fair.
The first reported case of breast augmentation specifically, or what was specifically a cosmetic procedure in the literature kind of recognized, was in 1895. There was a Dr. Vincenz Czerny. There's a CZ in there, so I hope I'm saying that correctly.
Czerny?
Probably not.
Maybe Czerny.
Maybe Czerny? Sure.
Polish?
Like
No.
Czech? Like Czechia?
Czech.
Oh,
Yeah.
I just said that wrong too. Anyway, doing great. Heidelberg cancer surgeon. So he was sort of a notable, he did a lot of cancer surgeries for multiple cancers. He had a case report that he published from a purported opera singer. So somebody who was rich enough to be able to pay for extra surgery. And
they just said they were an opera singer and nobody checked them out?
I think the case report doesn't name names, but everyone kind of figured out. I think that's kind of what that is.
Oh, I see.
So that patient had what's an inflammatory...
was he hinting at it in the case report? Was he just like, so I did surgery on somebody who yells loudly into empty spaces in a musical way for a living, but I don't want to give away their identity?
Yeah,
They wear Viking hats while they do that.
Yes.
Large lung capacity, maybe.
Yes.
As one has.
I think that's how they did it.
So the patient had an inflammatory adenoma. So that's it. Anytime you hear oma, it's usually less severe. So it's a benign mass, but because it's inflamed, it's painful. So he did the operation to remove this inflammatory adenoma, but then it sort of left a depression there. And so he transplanted another oma that she had, a lipoma, which is a sort of a fatty tumor.
It's a fat oma.
Yeah. So it'll grow over time, and it can be anywhere at once, but it's like usually somewhere. Actually, yeah, it can be anywhere at once, but it's this kind of sort of poofy, soft, non-tender type of growth. And it's fat. It's like a fat
it's just
inclusion.
like a lump of fat, right?
Mm-hmm.
But she's walking around with a lipoma that she clearly doesn't care about because she's not had it removed.
Mm-hmm.
Why would she care about this reverse lump somewhere else?
Well, I mean, I'm assuming, first off, well, that gets into some of the bigger questions about why breast reconstruction is so important.
Yeah, no, I don't think it's unimportant. I just think it's kind of funny that he's like, oh, you got a lump there, you got a lump there. I'm going to take that lump and put that lump up there. And then now you know.
That other lump is probably more easily hidden and probably less, you know.
I mean, I do appreciate the symmetry of that thought, though. It's like, well, there's extra here. Let's move it over. Have you guys ever taken out lipomas like anywhere? Because we don't usually do it in the emergency department.
No,
but like
I did a
family practice rotation. We took out a bunch of lipomas, and it's so satisfying. You just like,
are they little?
They can't. I mean, they could get pretty big, but like some of them, like I don't know, generous walnut sized are kind of some of my favorites.
I think I had a small one removed.
Yeah, okay, that too. Yeah, so you basically you numb up the skin, you make a little incision, and then you just like carefully deliver this little and they're very well encased, just this fat round. It's literally fat. It's a fat round blob. You just like deliver it out of the hole, and you kind of cut around it. You try to get the whole thing at once, so hopefully it doesn't grow back. And it's this big old sack of fat globules. It's very satisfying. It's like one of my favorite procedures that I never do anymore.
Do you know what he should have done though? He should have taken out the adenoma and then just stuffed the hole with dog hair. That's what I would have done.
That
say forget the lipoma.
Might have been very irritating, which we'll get to. Yeah. So he treated the hollow. I mean, I think, and so that was kind of this success. It was a success story. She did well. So Vincent Chesney is considered the father of cosmetic breast surgery. But then it, that's kind of the high point, unfortunately. So the anesthesia and sort of the underneath incision, the breast reduction surgery became more common, and the medical community decided to start weighing in on aesthetics of breasts in general. So in 1924, real high water mark for the French, Eugene Briot actually published an article. So he did a survey of 100 working class French women and decided to categorize their breasts for aesthetic purposes.
I bet this was sensitively done.
Wow.
Yeah. So it wasn't a survey, really. It was like a...
Wow.
It was a survey by
like
Eugene.
A lineup? Yeah.
Yeah.
Eugene, let's analyze your naked body, buddy. Let's have you stand up there and score you. Let's do it.
Eugene would definitely not hit the bar on the pole vault.
Yeah.
I'll just tell you that right now. One thing is, the listener can't see like how Alba's face changed when Aaron said that. Just the anger in the eyes.
Yeah, I mean, I'm
so mad.
Oh, it's pretty awful.
But they would have lined up men around the same time. There's probably
awful.
a study talking about like how far down testicles dangle, and there's some men that have perfect testicles. No,
could be. I don't know.
I don't know. I mean, he decided to define perfect breasts, so I'm not going to go into it. That's not appropriate. But there is a literal text passage that says this is what they are, and an easily attainable beauty standard. 13 of the 100 women sort of met his standard. So. And then he listed a bunch of reasons why they might not be perfect. He said, you're working too hard, you're eating too much, you're not sleeping enough, you do too much breastfeeding, and you're dirty. He said poor hygiene could cause. Yeah. So he just really knocked that one out of the park.
I just want to be clear, Alba, these are not Aaron's words. These are.
I know.
Okay, just checking.
Just saying, I'm glad he's dead.
Yeah, it's fair. He couldn't technically. He could be 100. Is he alive?
I don't know. Let's
I'm
go
gonna go
get
get
him.
him. I'm sorry. I shouldn't,
No, you go
maybe
ahead.
that's not appropriate for me to say.
Oh no,
that
he's not
before
alive. No, it's
someone's
okay, Alba.
dead.
He's definitely
fine.
But I get really mad about these things.
One of the least
'cause
defensible studies.
I've had to live a lot of the fallout of this type of thinking is
I think you're allowed to say it. I think I'm going to back you up on that.
I am glad he's dead.
Yeah,
All right, good.
Fair.
Oh,
Yeah,
no. I caught myself.
It's okay. It's okay.
He messed up some things for a lot of people.
That same year, there was M. Pignes. I don't know how to say that. Also a French guy. So he published a sort of a different angle, sort of a lament and an op-ed in the medical journals about how bottle feeding was going to cause breast atrophy and ruin breasts for all eternity. So there was a lot of like the 20s was sort of the advent of a lot of,
don't feed your children.
Yeah.
Preserve
the
boobs
yeah.
for the pleasure of someone else to look at.
Yeah.
Yeah, but they were just operating on the breast data that they had at the time.
On the breast data that they had. Instead of the best data. Okay, right?
Yeah.
Okay, all right.
Mike
Just
had to nip
checking.
in there with the pun. It just couldn't.
Yeah, keep doing it though. Make me laugh so that I don't.
Yeah.
Am I going to get madder as we go along?
Oh, maybe.
Aaron,
Yeah,
I might
maybe
cry.
A little. Yeah,
I
maybe a
hope
little.
I don't cry,
Yeah.
but I
No.
might. Okay, yeah, keep doing that so I don't cry.
So they decided they should address this. I mean, there was we got to save the breasts. So there was a whole stretch of time from about the early or the late 1800s into the 1920s, about the same region we're talking about, where they said, we should do something about this lack of perkiness. So they thought, why don't we inject paraffin? So
the wax?
Yeah. So paraffin, it's a wax. Max, do you know what paraffin? You want to describe paraffin?
I don't know what it's made of, but I know it's flammable, isn't it?
Yeah.
You can do like a paraffin wax, like a manicure, right? Like it rehydrates your hands and stuff.
Yeah,
it's
either waxy or Vaseline-like in consistency. It's definitely a hydrocarbon, though, right?
I know that I can. Yeah, I know that I can make fire starters from like the wood shavings in my shop, and then
Well, how about you inject that in your breasts? So
maybe I will.
Well, this is interesting with the time, right? So the 1920s. Now in America, that's kind of like the age of the flappers, right? But still very conservative all across the globe, probably. Like we wouldn't be looking at women's breasts. Like when would it have been like prudent for them to care about what women's breasts were like if they're covered and hidden?
I'm going to go on a limb and say that guys for all of eternity have been.
No, I know, but then it would just be like, okay, yeah, there's your boobs, big deal.
Based on the modest dress of the time, etc.
Yeah, how would this be a problem?
Aaron, this was in.
Had to solve?
Did you say this was in like 1899? So people were way more scandalous back then.
Yeah, the paraffin method started right around the turn of the century. So, like I said, there's a lot of things happening kind of concurrently. The groundwork, though, of doctors holding forth on aesthetics is important part of the story as we get into the later portions too. But yeah, they were like, okay, we're going to fix this because it's a big problem and it's distressing for women. It's distressing. They almost always would say that it's distressing for the patients. So Dr. Guersney.
You're making up names now.
I'm not. So it's the Guersney method. He said, okay, here, 1 part paraffin and 3 parts olive oil.
Oh, that's good.
And they would inject that. And what happens is the paraffin literally irritates the connective tissue enough that it sort of locks in the paraffin, and the olive oil keeps it in place. And then it turns into this sort of inflammatory spot where the paraffin sticks and creates increased volume. So
you're making a giant granuloma, aren't you?
Yep.
A giant what?
It's a granuloma. It's like where if you get some foreign matter under your skin, like let's say a splinter, the chance is if you get like a splinter deeply enough in your skin that you can't get it out, or let's just say you forget about it, your body will often deal with those foreign objects by turning them into what's called a granuloma. It's where a bunch of inflammatory cells from the immune system surround it and start like putting calcium on it and like making this nodule. It's like something you can feel. Just make it a lump, and sometimes it can continue to grow, and just like because your inflammatory cells just keep adding calcium to it. And so, yeah, granuloma is usually an inflammatory swelling of like calcium in in dead inflammatory cells. It's just
Mike
that's
can't
what he's
even.
doing.
He's like sitting back. He's like, I can't even.
Yeah,
It's
that they injected this into
yeah,
anything
yeah,
in their body.
yeah. And so lucky people would develop what they called them at the time paraphenomas, because other surgeons were like, look at what you did. Now I have to deal with this. So if you're lucky, you get a purplish, what's called indurated. So the skin tissue itself is kind of a little wrinkly. You get this mass. They usually, if you were lucky, non-tender, they usually didn't tend to ulcerate that much. The people that were in favor of this method were like, it's not that bad. But yeah,
Wait, are we
When you say
circling back? This is
ulcerate, what does
Right.
ulcerate mean?
means like a wound, like an open
Oh.
sore. They didn't turn into an open sore, so yay! It's a victory.
you said they're doing this for cosmetic, like just we want to hit the standard of beauty at the time. So is that why they were doing
Because it
this?
doesn't sound like it's gonna turn
Sounds
out
horrible.
looking.
But what I'm saying is that the standard of beauty didn't exist because there was no standard to judge it against. If it's all individuals judging their own beauty or people's
I
husbands.
feel like indurated purple.
Wait, did they not have bras
inflamed
at the time
breasts?
too?
Yeah, it doesn't sound. Nobody thinks that's good.
All valid questions, you guys. Good job. I don't know. So no, this was for. So these were not procedures done for breast reconstruction because they wouldn't work that way, right? I mean, I think if you had a radical mastectomy at that time, you would try to do a flap or something like that, and that was kind of ongoing. I would say we're like there's multiple tracks here to keep in mind, but yeah, this was mostly cosmetic, and nobody really kept good track of it. It was done all over the place. It was like a known method,
And it sounds like it was done to address just like regular aging of the skin.
Well, it's hard to
Or
say
like
because maybe it's
Yeah.
like really bad breast asymmetry. Because again, what I'm trying to think, like, were big boobs sought after then? Like that was kind of like the TB chic. Everybody wanted to be sickly and thin, so then you'd think you'd be small breasted. Maybe that's what they wanted.
Well, and also like I see what you're saying, Mike, is like, how do you know if there's nothing to compare? If everybody's being modest, then ideally, the only boobs you're seeing is your wife's boobs or your own boobs, and that's kind of it. But I think I honestly have no idea, but I would guess like, clothing and stuff like that gives the appearance of clothing and bras and stuff made to like lift the breasts and give like a rounder appearance, a smooth appearance, versus like, nobody's going out in a muumuu and hanging low, they're like everything is all hoisted up. So, then you go home and your wife's hang down, and then it's like, wait, that's not normal. Everybody else's are up. But it's
You're
just
what?
'cause
You're
you
what
only
now,
see
Alba? Your wife's what?
breasts. What did I say?
And she can say whatever she wants, man. I
Should
think,
not say
yeah.
this? I'm
No, I
sorry.
think this was cosmetic use. There's a very interesting thing to just call out directly, which is doctors, both in the 1800s and all the way through this story in this episode, are they feel very comfortable just coming out and saying exactly what's going on and talking about, saying things, especially in the 60s, like women are sad because their breasts don't meet the beauty standard. I mean, that, that's essentially, and so we want to help them. We're there to help the women. That's, that's a big
We
sort of
set the beauty
undercurrent.
standard that they don't meet, and so they're sad that they don't meet the beauty standard that we set. Yeah,
Yes.
great, makes sense. No,
So,
I get
No,
it.
here.
I'm
During
explaining
the 20s,
to Max and Mike something that Alba's
No,
like, yeah,
I know
yeah.
it's not you. I'm sorry, Aaron. It's
No,
not.
you're right. I mean, this is the
Okay,
cycle.
it's not you. It's
100%,
it's them.
that's the cycle.
Okay, great. Just
But-
want you to know I'm not mad at you.
Well, and I
I'm actually a little mad, Aaron. I'm gonna be honest with you.
that's fair. I don't know why I did this episode. The further I get into it, I'm just stuck between two giant obstacles, and I can't get myself out. So, no,
I
it's
appreciated that.
Sorry, that was I got that joke late. That was funny. That was a funny.
Oh, but
joke.
here, yeah. So in the 1920s, women wore, I think it's brassieres. It's spelled funny, to flatten their chests and straight
Yeah,
dresses to
okay.
minimize curves.
Yeah,
and
no, I got
chop
that.
off
I
their
got that.
hair.
I got that.
Yeah.
Wait, I got a cool details about that exact thing.
Ooh,
Just wait
okay.
1 second. So there were critics during this time. So H. Lyons Hunt is a very prominent surgeon critic of paraffin use. He filed a case report. I was like, yeah, I had this lady. I actually had to amputate her breasts because the paraffin was so bad that it turned into this chronic wound and little bits of paraffin kept coming out. And then there are also case reports of paraffin getting absorbed and circulating via the lymphatic system. And put a pin in this, they were worried the paraffin was circulating and causing joint pain all over, rheumatic illness, something like that.
Aaron, I'm not going to put a pin in it. They've done enough damage. I don't need anything else.
Oh.
And no more pins. Yeah. So, the other camp here is sort of, there is a definite need, again, still for reconstructive surgery, and plastic surgery's heyday was in the early part of the 20th century. Back to our facemaker episode in World War I and reconstruction of fascias. It's the same kind of thing. It's taking soft tissue flaps and moving them around so it looks somewhat normal. So that continued kind of through the 20s, but they continue to sort of just, in an interesting way, go after this concept of quote unquote breast atrophy. So they tried to really figure out ways to sort of create volume. They tried glass balls. So they would put glass balls in people's breasts to create volume.
What?
Yeah, I don't know. I was wondering like what size, like lots of little ones maybe,
Yeah,
or
it's
like
either
a
gonna
sandbag
be-
type thing, or like if you put just a big ball in there, that would be really weird. I don't know. I didn't
It's-
look into what.
either going to be really heavy or really fragile, I would think.
Yeah,
And you
maybe
don't-
both. I mean,
or both,
and then do
yeah,
you
that-
sound like a chandelier if you run too
Ding,
fast?
ding, ding, ding.
It's- There was also this in the 1920s. There was a whole concept that if you fix the breast, you actually improved hormonal balance. So they're like, well, the cause of hormonal imbalance is that your breasts are not right. So if we fix those, you'll feel better.
Yeah, it's not the oppression that's making you feel bad. It's the boobs. Let's fix those. Let's fix those. Okay.
So I like that they thought it was shape related. It was just like, no, it's just the shape.
Yes.
If you fix the shape of them, the endocrine glands within the breast tissue will work better.
Yep, that French guy wasn't the only one who had thoughts.
Mm.
Dr. Lillian Farrar, actually a very accomplished OB-GYN in the 1900s. I almost hate to pull her into this because she did a lot of really cool stuff in the early part of the 20th century. But so she actually attributed breast atrophy to people binding the breast during the flapper styles in the 1920s that Mike alluded to. So she's like, you're binding them so hard that the reason they're shrinking is because of fashion. So she's kind of taking a shot at the flappers.
Interesting.
So
was that actually true? I could imagine if you compress the tissue enough, it doesn't get as good of blood flow, and perhaps it could atrophy, especially if the glandular tissue, the tissue that's active and making hormones and that sort of thing, was starved of blood flow in some sort of chronic way. Maybe.
Well, like the rest of this, Max, there is no study on the efficacy or safety of any of these things until after you try
Probably a
it.
study we should not do.
Moving on to sort of the next phase, at the meeting of the Society of Plastic Surgery in 1935, H.O. Barnes described again.
Barnes.
He described multiple types of quote abnormal breasts, and he essentially got up in front of all his homies and framed the surgeons as saviors of women with quote abnormal breast development who quote literally look with envy upon the well-formed figure of another woman. So he was basically saying in front of this, we're going to save. I'm sorry, I can't keep going. I just can't.
This is
ridiculous.
I
can't say it anymore with these bastards. Anyway, so yeah.
You're doing great, Aaron. You're doing great.
I mean, but I think this is sort of this, it's a through line of, from that French guy, what was his name? Let's forget him. So that's the setting for all these continuing sort of ongoing, all of this stuff is sort of ongoing. They're continuing to sort of reconstruct, inject, do what they can to try to help, but the 40s and 50s sort of
1940s and 50s, right?
Yeah. So we're in the 1940s and 50s now. So the post-war era marks a significant shift. And there are a few factors to that. One of them is that the surgical techniques have continued to advance. So they're getting younger and younger patients where they're actually comfortable sort of intervening on different conditions, quote unquote. I'll put that in quotes. There are more advances with regards to cancer recognition and treatment. So you're getting more mastectomies at younger ages where people have to sort of confront what they would do about, a mastectomy, which is a significant surgery for a lot of reasons. And the 50s is also an era of experimentation with a lot of different sort of technological advancements after World War II. So there's this whole new love of technical solutions and scientific solutions and chemistry. So what they basically said was, let's take all this cool stuff in the 50s and put it in women's bodies and see what's happens. That's they do mouse studies quite a bit during this time. So they put mouse and dog studies. These
Are you gonna tell us about mouse breasts?
They would itty bitty.
The breasts. The mice, they would typically just inject whatever thing they wanted to make sure it was safe.
No, I don't like that as much.
Yeah, and then they would see if the mice got cancer, which often the mice got cancer from the stuff they injected.
Okay,
but then they're like, yeah, but it's probably a different mechanism, so we think it's fine. Then for the dogs, they would usually actually implant the tissue in the dogs to see how it looked, and they would usually follow. Most of the dog studies that I read about lasted about 12 to 18 months.
Are they building breasts on dogs?
You need less dogs because they have more breasts.
Yes.
So you don't need 100.
You could test 6 different kinds at
Wait,
once.
are they putting the breasts and the dog's actual breast region? Or are they putting... Because I would think if you're trying to see how it changes with gravity, I would put the breasts along the side.
Those dogs look ridiculous in flapper dresses.
And then you do need less still. Yeah.
Poor little dogs. Yeah. So
Alba's given this way more thought than I would have necessary.
So they said, and this is going to be hilarious to us in the modern area. They said, hey, nylon, that sounds good. Also plexiglass, that sounds really good too. Also polyester, maybe we could try that. And maybe some Teflon. Like that sounds really, really good. Maybe some
because you want it to be non-stick breasts.
What? Aren't there just a lot of hard plastic?
Well, hold on. This is just like the space. This is like, all right. I'm trying to put myself in their head. This is 50s, right? We're in the 50s, so this is an era where they're discovering all these cool things like nylon and spandex. I guess is pretty exciting for the time. So they're just discovering these objects, and the first thing they're like, you know what? This could be boobs.
Yep, this could be boobs.
This could be boobs.
So it's sponges, almost always sponges in the 50s. So they made sponges out of these different polyester, Teflon, nylon variants.
I don't know why I said that. Like, oh, that makes sense.
Because of the texture. Because I'm picturing
right. Normally we think of Teflon,
nylon,
right, or nylon, right.
I'm picturing a pair of spandex, but I realize I don't know the difference between nylon and spandex.
Exactly.
I guess
they're different.
So even in the dog studies, this was 2 surgeons. I don't remember their first names, and I don't care. Grindley and Waugh, or Wow, I don't know. So these 2 plastic surgeons were like, "This is cool. Let's try this. Let's sew these sponges into these dogs." And they would then remove the sponges after about 18 months. And they even saw at the time that the body had sort of built a capsule around the sponge somewhat, and it actually grown into the sponge to some extent. So there were like vessels and connective tissue that had sort of grown into these sponges. And they're like, cool, that seems like it's probably quote unquote inert and won't interact with the body, and thought that maybe that would be a good thing to like put in patients.
Wait, what?
Yeah, yeah.
I ain't no doctor, but I want to make sure I got this right, because this does not seem right to me. They said the tissue, like the test subject's tissue, started to grow into the sponge. And they said that's fine. It's not going to interact with the body.
Right. So, and again, I mean, I think there are, and I'm way out over my skis here because I'm not a surgeon, either plastic or otherwise. There are quite a few, well-used devices, which we'll get to this in a little bit too, that do sort of form, interactions with the body. But with this one, yeah, I mean,
like sort of a scaffold for all those cells and connective tissues to build on.
Right. So now we got to say, good job, Texas. There's a lot of Texas surgeons that sort of step to the fore here. A lot of plastic surgeons, they just are like, you know what? We're going to figure this out down here in the Lone Star State. W. John Pangman was a proponent of these and just went full send on all the sponges in the 50s. So he would cut these sort of early sponges into a breast shape. He said, they're kind of like white bread texture, these sponges made of Teflon or whatever else, polyester, and he'd put them under the breast tissue. And then they'd make the body would make a fibrous connective tissue capsule around the implant. And he thought if, he just sort of continued to tinker with different formulations of sponge and plastic and such to try to figure out the best thing.
Maybe they could have. Did they try using asbestos in them? I mean, I feel like it's kind of on brand here. I mean, why not try a little asbestos in there? That way, they're not only non-stick, but they're flame retardant.
Yep, exactly. Anyway, I don't even have a good
when
joke
did the lawsuits begin?
Oh yeah,
right?
pretty
Where are
soon.
those?
Yeah, not quite yet. There was also another surgeon, Robert Allen Franklin, in Los Angeles. So we got Texas and LA kind of teaming up. So he a little bit outside the mainstream of plastic surgery, who
That's
was
not a
also
good
doing a
place
lot
to
of
be.
breast augmentation using sort of native tissue. So he did a lot of transplants. He was notable. I kind of lose track of some of these guys in the parade of awesomeness, but he came up with what's a breast quotient, in quotes again. So he had a formula to calculate the exact degree of, deviation from the mean. So he was famous because he essentially promoted, he said, gosh, a lot of people are really sad, and I can do a simple 25-minute procedure using inert foam. This is quotes, simple 25-minute procedure using inert foam impregnated with penicillin, and just put that in the office, and then you'll have fuller breasts and you'll be happier. And then he actually, in magazines at the time in the 50s, estimated that he thought about 14 million U.S. women could use his help. So he put a number on.
Alba, do you have any thoughts on that? Just
Wow.
notice the head turn for a second.
Wow. I mean, 14 million US women could use his procedure, could use his help after he's used a formula to calculate how flat-chested or large-breasted a woman is. And he's like, hey, let me tell you, woman.
I think the actual correct thing, though, I feel really bad about jumping in with a correction while you're on that roll, Alba. But
please.
I think the formula was not about how flat chested, but like how correct chested they should have been.
Oh, I'm so sorry. Yeah, that's right. Because
makes it better.
Yeah, that makes it even better. Yeah, because it wasn't like, hey, it's all good. You can be whatever kind of chest you want to be. Everybody love everybody. Nope. It was either right chested or wrong chested.
You could argue that nothing has changed, right? Like, think about the commercials for Ozempic. They're essentially saying, like, you're fat. People in the country aren't. You need this medicine. And just this guy's trying to make money. When I read this, it's like he's like Goat Balls guy. He wants to turn this procedure into tons of cash. He doesn't really care. So he's like trying to play into people's insecurities.
Yeah, I tell you have a problem, and then I sell you the solution for the problem that I just told you had. Yeah.
And 25-minute outpatient procedure, that just sounds like cha-ching. You can do a lot of those in a day. Money 2 an hour, like 16 money. A day. So yeah, these two were outside the mainstream. So but people just continue to sort of experiment, kept doing mice studies, kept saying, hey, when we inject these things into mice, they tend to not do well. They might get cancer or systemic illness or some such. And then dog studies kept being like, yeah, it looks pretty good. Let's try that one. And then at the plastic surgery conventions through the 40s, 50s, and 60s, there was this sort of, kind of like Twilight, team natural, team artificial fights between the two different.
Like Twilight.
Yeah, right. Yeah, for sure. They were, but so reconstructive techniques, there were a lot of surgeons who were like, this is not okay. You need to use natural tissue. But reconstruction techniques are more limited. So really what the argument was for folks that espoused artificial implants, they said, well, this will bring breast augmentation to the masses because not everyone is a candidate for reconstruction. Reconstruction tended to be more about recovering after cancer surgery and such. Yeah, it's hard to even anyway. Oh my God. So that the big game changer then in like the late 50s, early 60s was silicone. So silicone, same 50s milieu. It just was one of the things that they experimented with and found this really great sort of solvent, lubricant, gel stuff that worked really great. Super inert. And I got to be honest, there are multiple quotes of surgeons that are just like, "Ooh, this feels really cool." So they liked how it felt when they put it in a little bag. Thomas Cronin and Frank Giroux, they are, I think one of them might have just died. Texas, again, plastic surgeon and one of his residents introduced the silicone breast implant in 1963 at the convention to great fanfare and much excitement. It had 3 sizes. I think the largest was about 320 milliliters, which was called the burlesque.
Oh goodness! Can I imagine this? I want to imagine what the swag at this convention was, because you used to get like all those little pens and stuff, like, and that's always. But this had to be crazy. This was just crazy. All these little desktop things, like bobbleheads that are really weird and problematic.
I mean, the bobbleheads.
Silicone does feel really. It's a cool substance. I've done like moulage stuff with it before, and I could see if that was the swag, like going home with a silicone.
Yeah, it was lauded for its natural feel, and then they also said it was inert, so they were excited because they said this doesn't interact with the body at all. So, and then we get into this apocryphal story that I talked about at the beginning. First was, so it was Giroux's, the resident's idea about putting the silicone in a bag because he was squeezing a bag of saline and said it felt like a breast.
Oh, yeah. I remember that now.
Yeah.
Nice callback.
I did link to it. The only place I can sort of find it is on a website that has a ton of pop-ups and no references. So I
probably legit.
I don't know. You know, and then in parallel development, silicone was also discovered around the same time in Japan, but they just injected it. So there is an oft-repeated story in Japan from the 50s that there was a Japanese industrial company that actually made silicone for industrial cooling, and their warehouse just kept losing the silicone, and they were like, where is our silicone going? And then they investigated, and it was apparently getting stolen to get injected into the breasts of Japanese prostitutes to make them more appealing to American soldiers. There aren't any sources for this story either, so that could be a myth. But there was in Japan at the time in the 60s what was called a Sakurai formula that was published. And he described sort of silicone with vegetable oil, similar to the paraffin. I don't know why he thought it was a good idea after what happened with the paraffin, but the silicone, he's like, silicone's better than paraffin. Maybe so. You combined 1 part silicone, 4 parts vegetable oil, and then injected that, and the vegetable oil would hold the silicone where you wanted it. I don't know why.
The thing that worries me is that if they had a specific ratio, it means they tried other ones and it didn't work.
Oh no, that ain't good.
So this is 50s, 60s, 70s. So this is, we could probably do a whole other episode on I have done about.
This is during your high school, right?
Yeah, pretty much. You know, I was,
sick burn.
You know, I mean, close to college age. But so the FDA and, you know, the death of patent medicines had happened before, but the FDA is starting to get new powers to regulate. And silicone as an injection in the US ran into the FDA because they said it was a drug. The FDA, friends, as we know, but may not be super common and comes into play here, distinguishes between devices and medicines. And in the 60s, they don't really care about devices so much, but medicines they regulate quite heavily. So the silicone injection, that's a medicine. It's dangerous. It's not proven. You can't do it. So the FDA basically said you can't inject silicone for cosmetic purposes. So,
okay, well,
I mean, even though they didn't approve
it for funsies,
but the bag, you could do silicone in a bag and then put the bag in there.
Because the bag is a device.
Because it's a device,
it's not a medicine.
But I don't understand, how would you just inject the silicone and then you just expect it to stay in the same spot?
That's what the vegetable oil's for.
Yeah, that's also not good. Like it just, none of it, because I would think the vegetable oil would.
That's probably the ratio. Like if there's not enough, maybe it's too lumpy, and then if there's enough, maybe it's a little softer. I feel like I don't like that I put myself in probably the same thought pattern that they had, but
I guess it depends too. Like, because when you do the silicone in a bag, it goes behind the mammary, the itself. But then if they're doing the injection, are they injecting like right under the skin, or are they doing like a whole bunch under, you know, like a big volume under the mammary, or if they're doing like little bits just under the skin
was
all around?
Definitely deeper, and I a little bit, again, out over my skis. But yeah, there were even some folks that talked about injecting like under the pectoralis muscles. So it's a very deep
Oh.
injection.
Ow.
Yeah.
Yeah, that sounds wild.
Yeah. Or implanting the bag underneath the pectoralis muscle. That was another sort of change. But yeah, it goes behind the breast tissue and then sort of sits there. And if you look at the early breast implants, like they had like a non-stick backing, and that was going to go against the chest wall. And then it was like, it had from the side, it had like a specific shape. I mean, they thought a lot. They thought more about how to do this instead of whether they should. And the design of the early breast implants and even the later ones too, probably. They thought a lot about, because this was always the problem, like things would dissolve or move, and yeah, that's no good. Even with the lack of FDA approval, there is a survey in 1967 that shows that over 75 doctors were offering silicone injections in Los Angeles. So, and actually Dow Corning, who we'll hear of again potentially, was a chemical company that made silicone, and they were indicted by LA County, I believe, or someone similar, for selling silicone to doctors who were injecting it, and they settled.
Wait, they're just selling it off the back of the truck?
No, I think they're probably selling it from, that's why they got indicted, is because they actually were selling it when they shouldn't have been for medical purposes.
My goodness.
Well, there's a lot of stuff that's not FDA approved.
Yeah, that's true.
Not quite like this, but
yeah. The silicone sort of excitement in the 60s led to a more aggressive acceptance and use of mastectomy. So they started talking about in the 70s, or like, there got to be a blurring of the lines. So they're like, well, you might have fibrocystic breasts, which is actually just a condition where the tissue is, how to describe it. The tissue itself is a little denser. So they'd be like, well, that doesn't seem like something you would like. So maybe we can just do a replacement for that for you. So they kind of said, well, this is great. We can do this for more things, or maybe we can even do it protectively in case you had a tiny thing, or we want to protect you from breast cancer. So yeah.
So they were just removing perfectly healthy breasts?
At times, yeah. Which, yeah, they were. There's just bad studies all around, and it seems like people were doing it frequently. There was one surgeon who actually studied things in the 70s, and of 700 patients that went through the procedure for augmentation with silicone implants, 65% had pain afterwards, 33% had fluid that built up, 33% noticed that the implant was like hard to the touch on the outside, and 28% had skin wrinkling. So yeah, I mean, there was not a lot of tracking of complications, but the ones that didn't really help make me feel better about the whole thing.
Listener, I'm looking ahead for a second. I need Aaron to talk about this sentence.
Yeah, I mean, it got to the point that they were saying, like, the 25 minutes, they started to do more of these procedures in the office with Valium, which when the dentist says, we'll give you some stuff so you don't remember your tooth extraction, that's essentially the same. So they would do in-office procedures, breast augmentation with Valium alone, and then you go home the same day, maybe not alone, maybe some pain medicine too. And the pitch was, it's more affordable this way, so more people can get it if they need it or want it.
Oh well, okay.
Yeah.
Oh, so they were awake and just hopped
awake-ish
up on Valium?
Yeah. Then you don't need
mostly
an
awake if it's Valium.
Mostly awake, yeah.
Mostly, oh
Hey,
my.
look, I had Valium when I had my LASIK surgery in like 2005. And I felt absolutely awake during that whole thing.
Yeah.
I had Valium for my wisdom teeth extractions, and I remember a lot of that.
Yeah. So, but you should, I mean, you probably wouldn't, I don't know. I mean, it doesn't, it's not great. So this kind of continued through the 70s and 80s until everything kind of blew up in the early 90s. So there was this huge controversy with silicone breast implants specifically. So a couple things happened. 1976, they passed a Medical Device Amendment Act where the FDA had to place all devices into 3 categories. And if you were in this class 3, you had to demonstrate that it was safe and effective. And so they actually said, well, maybe we should regulate some devices. Right.
Woo, thank goodness.
About time.
Finally.
Right.
Fortunately, there's no loopholes in that system to this day.
No, not at all. It works extremely well, and it's all done. around that, so that was one thing, that law got passed. There were also some cases, so people started suing Dow Chemical specifically and surgeons for complications, and there were a couple cases there that kind of made it into the public consciousness because there were large judgments. And then there was because of one of those trials, Dow had a bunch of internal memoranda and studies that got leaked by one of the people in the courtroom that kind of leaked, and Ralph Nader helped leak it to the public. He also gave us seatbelts. So good job, Ralph, protecting us from breast implants and lack of seatbelts. But they had sort of a rat study that showed that a rat injected with silicone had developed fibrosarcoma, which is sort of a rare type of tumor, so cancer risk. And it just kind of started to gain momentum from then and turn into this big old huge thing. There was also a Sybil Goldrich, who was an author for Ms. Magazine, who had gotten implants and then had a very bad experience and had to have 5 sort of surgeries to sort of recover from the implants, and said, essentially, you didn't let me know what I was getting into, which I think is a fair critique.
It sounded like they didn't know what they were getting into either.
Right. They're just like, let's just put these in people and it'll be fine. So yeah, so there was do you guys remember Connie Chung?
Mm-hmm. Oh, definitely. Yeah.
So she got a hold of this controversy and put it on one of her nighttime shows. If we have any young listeners, Connie Chung was on something called TV, and she was a what's called a news anchor. Yeah. So, yeah. So, and then there were a lot of concerns about, autoimmune disease from the leaking silicone. That is something I think that's unproven. So there was just a lot of concern about it. Unproven, but I mean, you're injecting someone with silicone and the silicone bags leak. So these sort of internal memoranda from Dow Chemical started to come out and get leaked. And there were all sorts of very concerning things that they were talking about. So they're like, there was a task force in the late 1970s or 80s that was called the Mammary Task Force. So the Dow...
Wow.
I mean, they could have had, like, what better name could they have had?
It sounds like big boobed superheroes.
Boob Squad.
So they said, let's make some new boobs in 5 months. So they gave them a 5-month timeline with the silicone to kind of roll out a new product. And that's just not enough time to properly develop a brand new medical implant. And they had documents in there that, first off, like, there are all these emails going back and forth about make sure to wipe off the leaking silicone before you show them to customers. And do these leak? Yeah, they might leak. Oh my gosh, does that matter? I don't think it matters because silicone is inert. Like, a bunch of really damning documents, and just didn't do well.
I like to imagine the silicone implant salesman just like putting a slap of like Flex Seal on there. It's like, nah, it's fine. It's fine. We got it.
No problem.
It's all locked up. Don't worry about it.
Off the leaking silicone before you show patient. Wow.
Yep. No, it's great. It turned into a 4 or 5 day like congressional hearing, and then a 4 to 5 day like broadly publicized FDA panel in the early 90s. And yeah, I mean, there was a big fight. The American Society of Plastic and Reconstructive Surgeons made a PAC and ran a PR campaign and said, basically, it's a woman's right to make an informed choice about breast implants, which is not an unreasonable argument. I mean, there are things where women should have the right, if they know the risks and benefits, to say, I want implants, and that should be a choice they can make. But I think it's a little cynical for the company to roll it out. Alba, you give me a look. But like, yeah, I mean, that you're like, I feel upset because they're using a line of argument that sort of makes sense, but they're co-opting the idea of a woman's choice.
Yeah, the look is, I'm trying to follow. I'm trying to follow the logic on that. And I guess I'm asking myself, where do I think the line is too? Because that's kind of an ethical question, is should somebody, you have people that sign out, as, we say every episode, AMA, that's like, hey, we told you not to do this, but you're going to do it anyway. Or, and then also the question of what's the, I don't know, what's the ethical obligation of drawing the line of safety as far as making something legal to exchange that from one person to another. Yeah, I don't know.
I think the question is too, did we really have the full understanding of what the risks and benefits really were? It sounds like we have studies kind of going back and forth, et cetera, but there's a lot of suggestive issues here.
At the time of the panel, that was what killed the companies and killed the silicone implant in the 90s. They actually placed an embargo because when the companies came with their studies, they were like, here's some mouse studies and here's some dog studies. And we don't really have any human studies and we don't really know what happens.
It seems like a problem.
Yeah. So they basically, like the panel, long story short, said, yeah, there's no proof of safety here. You can't prove that you've just been putting sponges in bags in women's chests for years with no kind of oversight, and
that's kind of the thing of like the informed, like they're not informed because, and even when you say like, well, how informed does somebody have to be or whatever, it's like, well, how do you control that? If the four of us go to inform somebody, to inform 4 different people about something, all 4 of those people are going to walk away with different knowledge, and so it's like that science not existing is no good.
They made a public health argument as well that if silicone breast implants weren't available, women would be less likely to get mammograms, and so you would have an increase in breast cancer. They didn't have any proof for that.
It's a bold move.
Because they want to keep putting them in. And to me, they don't believe, there's limited data and they don't believe it. They don't believe that it causes harm. So then, they're going along with the charade through these inquiries and hearings, not believing. I don't believe that they thought it was going to cause harm, even though there's data over the course of the previous 20 to 30 years. I would say that
I believe that they were incentivized to not pay enough attention to the idea that it might cause harm.
Yeah.
That there was enough money there for them to not pay attention. And if they were not incentivized to pay attention or to ignore, you know what I'm saying?
Mm-hmm. Yeah. If you don't,
like,
if you don't,
I don't think that they were like, this is probably going to hurt people, but let's do it anyway for the money.
The loudest people in the room were getting the most money.
Hey, you can't find a fever if you don't grab the thermometer. That's one of those things. If you don't look for it, you won't find it.
Well, and they, the thing is, like, they were asked at the hearings, how many people even have these? And they couldn't say. They're like, we don't know. So the follow-up on their devices was part of the issue. I think they just had no way. It is very interesting. So this, like, I think we're going to run out of time. So I think there's one other thing.
We'll wind down here.
We'll kind of wind down. But like, if you look at it now, there is epidemiological data that says there's not a definite link between harm and silicone implants. And I think it's hard to draw that direct conclusion, but that's the whole point. How can you have informed consent if you don't know? And also, I don't know. It's just such a tricky thing. Still,
Well, that seems like a perfect place to leave it. We don't know. Medicine is fraught like that. I don't know.
Yeah, where are we at? Yeah, we could. Yeah, I think. I think I've thrown enough shade.
Well, that might do it for now. I was going to ask Alba. My usual is any memorable tidbits from this episode that you would highlight?
It was interesting to hear about the lipoma removal and how that, like, how you said y'all have done that in the ED. Just, that sounds like a cool thing. And I'm sad I'll never get to do one.
I love that. That's what stuck.
Because it sounds like something I would really like to do.
Dogs get them too.
To try it on myself.
Yeah, you could try it on a dog.
Yeah.
Okay.
Wait,
Ebenezer?
Oh yeah, lots of old dogs get big old lipomas.
Only under supervision.
Okay. Weird. Does our medical license extend to Alba doing a skin procedure on her dog? I don't know.
Myself.
I'm sure it does. It's
gonna be hard to do on yourself depending where the lipoma is. Anyway,
see one, do one, teach one.
It's true. Anyway, we do appreciate everyone listening, and we'd love to hear from all of you out there. So if you'd like to check out our merchandise or provide feedback, we can be reached through our website, www.poorhistorianspod.com. There you can send us messages and find links to our social media sites. We do work to respond to all those posts on those accounts, and if you're looking for a way to contribute to the show and dispose of a few extra dollars you have lying around the house, or hey, maybe you just want some bonus content, you want to be a special part of the House of Medical History, check out our Patreon page at patreon.com/Poor Historians Podcast. A free way to support the show is to tell a friend about us or go and leave us one of those super nice 5-star reviews on Spotify, iTunes, or whichever platform you choose. Until next time, the Core Historian is signing out. AMA.